Hi, this is Dr. Kavanaugh at ACR 2023 Convergence. A lot of interesting abstracts presented here. I'm going to talk about one, is abstract 25, entitled Relationship Between Genetic Variants in Cannabinoid Receptor 2 and Self-Reported Effectiveness of Cannabis for Pain Management in Rheumatoid Arthritis. Of course, a hot topic for all practicing rheumatologists. A lot of patients want to know, is there an impact of cannabis on pain? And the data have been quite mixed. Some people say that it helps. It's hard to prove that in large studies, that it's effective for large groups of patients. But there are some people who do seem to respond. These data address maybe some of that heterogeneity. So this is from the Forward Registry, previously the National Data Bank. And they identified a group of people who said that they had reported cannabis use, and then asked them if they felt that it helped or not. And they picked people for whom they also had genetic sampling, and were able to look at several SNPs, single nucleotide polymorphisms, in genes relevant to the cannabinoid receptor. And they did find, interestingly, that there seemed to be an association between certain SNPs that were a small percentage of the population and the lack of response to cannabis. So I thought this was very interesting. It's self-reported data and it's remote, but the genetic analyses are sound. And as I said, we see heterogeneity in how people think cannabis helps with their pain. Pain is incredibly important to patients with rheumatic diseases. That's why they come to see us. So every little bit of explanation we have for the pain, but more importantly, everything we could potentially offer as something to help with the pain is certainly welcome. And the more we learn about which patients might be right for which therapies, the better we do. This is Dr. Kavanaugh at ACR 2023 Convergence in San Diego.